and welcome to our town hall this morning. You know, when I was thinking about how to best introduce Dr. Shah, it was impossible for me to actually put it in words that would make sense to me. You can see in the chat box that Dr. Shah has, you know, really remarkable qualifications and experience in the field of older people. But I wanted to tell you just two very stories that really describe to me the essence of Dr. Shah. And I can't talk about Dr. Shah without talking about Mrs. Shah, because they're the formidable team that work together on so many issues around older people. So just two very quick stories before I have the honour of introducing Dr. Shah. You know, one story is about when I was in India and I was in Pune and I was going to one of Dr. Shah's meeting and I was a keynote speaker. Very late at night, I burnt my hand and I burnt it very badly. And, you know, within 24 hours, Dr. Shah had scooped me up with Mrs. Shah by his side, and I was visiting one of the most prestigious plastic surgeons, you know, in India. So there was no question, you know, he was going to take me to the best people to make sure that I could heal well, and I did. The second story is really speaks to me about the essence of Dr. and Mrs. Shah and the Janaseva Foundation. Many years ago, you would have known that, you know, there was a man-made disaster in Japan where there was a tsunami, you know, post a breakdown of nuclear plant. And at that time, there was a lot of fundraising that was going on. And IFA put out a call, you know, for funds to be raised. Janaseva Foundation stepped up. You know, Dr. and Mrs. Shah, with all of their colleagues and their experts and their fundraising capabilities, raised $12,000 US. And that was the essence for me of who we're going to speak with today. You know, Dr. and Mrs. Shah, as I've said, are a formidable team. Qualifications just don't do justice. You know, they have a loving family, some in the US, some sitting right next to them, you know, to make sure that this town hall runs smoothly. You know, I will be a better person from listening to Dr. and Mrs. Shah today. So I hope you enjoy the experience, and please send forward your comments and your questions. So Dr. Shah and Mrs. Shah, I hand the floor to you.
Thank you. Good morning to everybody. Welcome to all, and especially Dr. Jain, Andra, Greg Shah, and all my friends also. Dr. Jain, you have nicely introduced me. Thank you very much for that. Both of us, Meena and me, are happy to see all of you. Jain, you have already visited and you told just now also. So you have attended and you have seen our long-term care facilities, daycare center for elderly, century clubs, and also participated in one of our World Senior Citizen Day celebrations program as chief guest along with late Dr. Sharat Chandra Gokhale, former president of IFA, and Dr. Gururaj Mutalik, former director of WHO. In fact, you inaugurated one of our national workshop on active and healthy aging supported by WHO Southeast Asia region. Today I am going to share our experiences related to COVID-19. We know that India is having 1.3 billion population, and more than it, 130 millions are senior citizens. This is second largest population after China. So in India, more than 1 million people suffered from COVID-19 up till now, and more than 25,000 deaths are there. And in Maharashtra, 284,000 people suffered from this, and more than 11,000 deaths are there. While in Pune, in our city, 28 1,142 people suffered from COVID and 872 expired. So in March, third week, number of cases started increasing. Our Prime Minister, Honorable Narendra Modi ji, declared strict lockdown in the entire country. And at the end of the second month, unlocking was started in phases. But unfortunately, after the second and third unlocking phase, the number of patients started increasing and government started lockdown in all red zones, especially in Maharashtra, Mumbai, Pune, and other cities. Because the number was increasing fast, the infrastructure, the beds in the hospitals, number of health workers, doctors, nurses, ward boys were insufficient. Even PPE, like personal protective equipments, were like masks, gloves, sanitizers were insufficient, and poor people cannot afford them. India is a developing country, as you know, with low middle income group having lot of poverty. More than 10 million senior citizens are homeless. They stay on the road and do not get even a single proper meal. Most of the senior citizens are daily wagers and they don't get food unless they work. So because of overcrowding in slums like Dharavi, in Mumbai and slums in Pune where single toilet is used by 70 and 100 people, spread of COVID-19 is fast, and now at some places in India, community spread has already started. Fortunately, because of tremendous hard work and all-round efforts by Mumbai Municipal Corporation, Government of Maharashtra and Police Department, volunteers from various sectors, special drive was launched and now the spread in Dharavi, Mumbai is under control. And this drive is now appreciated worldwide as Dharavi pattern. So senior citizens had to face major challenges like loss of income, deteriorating health because of poor health services, that too in villages, and social isolation, loneliness, psychological problems due to lockdown, with increasing domestic violence and elder abuse. Even non-availability of caregivers, maid servants, made the lives of senior citizens difficult. In health problems, those having comorbid conditions like diabetes, hypertension, ischemic heart disease, asthma, malignancies, there is a high mortality. As on today, 53% of all the deaths in India are due to COVID-19. They are seen in elders above 60. So to overcome these challenges, along with government, industrialists, NGOs, philanthropists, they came forward with many volunteers and even many senior citizens, including doctors, helped the people to tide over the crisis, and few of them lost their lives also. So we are waiting for the vaccine now. And in India, Barratt biotech company has recently come out with vaccine which is undergoing trials on human volunteers. And ICMR, that is the Indian Council of Medical Research, is working on it. We have, of course, few stories of warriors, and when time permits, I will share this. But meanwhile, I will like to tell COVID-19 and our contribution. So Janaseva Foundation, established in 1988, is working in the field of aging, health, destitutes, education, skill development, research, especially street children's education, village development, and in construction of toilets through more than 22 projects we are working. In aging, we are having old age homes, daycare centers, century clubs, rural hospital, eye hospital, wherein we do free cataract surgeries. Actually, we have done more than 20,000 free surgeries. Destitute Rehabilitation Center. Janaseva Foundation has received Vayoshrestha Sanman Award under the category of Best Institution for Providing Services to Senior Citizens and Awareness Generation by Honorable President of India, His Excellency Pranab Mukherjee. As such, I am participating in webinars organized by WHO, IFA, Ministry of Social Justice, Helpage India, medical associations, getting updated and sharing my experiences to fight this pandemic. So in this time of crisis due to COVID-19 pandemic, it is our responsibility to reach out to people in unorganized sectors, daily wage earners, and people living on the street. These are the most vulnerable section of the society. Due to lockdown, this group of people is the most affected with no earning and non-availability of food in many houses. Networking with other NGOs, our well-wishers, individuals, corporate donors, and Janaseva Foundation has been continuously providing help to needy and elderly as follows. So 500,000 ready foods served to families in Pune and villages is sort of meals on wheels involving more than 10 social workers and 3 vehicles. 15,000 kg grocery kits distributed in various parts of Pune city, including migrants, daily wage earners in villages and in block Vella and senior citizens staying alone in Pune. During 2 months lockdown period, in order to keep villages active, we have constructed 200 new toilets in villages, and till date, we have completed construction of 2,000 toilets. 200 senior citizens, out of that 140 are destitutes. They are staying at our old age home at Ambi. They are provided food, shelter, clothes, medicines, and health checkup, and 24 hours doctors and ambulance services is available. And IEC information, education, and communication material is distributed to senior citizens at various places. Thousands of masks and sanitizers were distributed, and 120 destitute children and adults are also provided similar care in our destitute rehabilitation center at Vilarewadi, Katraj, Pune. All 200 inmates of our old age home are safe. I am very happy to repeat this. They are all safe, as we know that 30% of the deaths of senior citizens all over the world are from nursing homes. In Mulund, Mumbai, in senior citizens home, out of 30, 28 senior citizens and 2 caregivers tested positive for COVID-19. And yesterday only in Savli Destitute Home in Sangli, Maharashtra, 52 had COVID-19, and therefore we took meticulous care of senior citizens in our center, ensuring hygiene practice, washing of hands, no touching, physical distancing. Visitors, including relatives, are not allowed in the premises, including volunteers and outside patients. Regular use of disinfectants like sodium hypochlorite for housekeeping and cleaning. Periodic checkup of body temperature, oxygen percentage, blood pressure, blood sugar, and use of masks and gloves and sanitizers by staff and caregivers is compulsory. To maintain their health mood, we insisted them to talk their relatives on mobile and Skype and WhatsApp. And we arranged various programs for their entertainment too. Our mobile medical unit, equipped with lab and medical instruments, ECG and doctors, nurses, they are regularly providing healthcare services and medicines to 65 villages in Vella Taluka of Pune district under National Health Mission scheme of Government of India, and providing 1 month's medicine for the diseases like diabetes, hypertension, ILD. Even today also our mobile medical unit has gone in the villages in spite of having strict lockdown. Under RRTC, that is Regional Resource Training Center, we are a nodal agency for Ministry of Social Justice and Empowerment, Government of India, having regular interactions with 48 old age homes, having more than 1,400 elderly in the states of Gujarat, Vidarbha, Union Territories of Diu, Daman and Madhya Pradesh also, for monitoring well-being of inmates and reporting to the ministry. And that we are doing regularly, and all are safe. We requested senior citizens to download and use Arogya Setu app on their mobiles, which is specially developed for COVID-19 by the government to spread the awareness. So we did special pilot study involving 200 senior citizens staying in Pune city as follows. I will like to have first slide, Andra, research side. So the psychological distress among elderly during this global pandemic COVID-19. So this research project, first research. Yeah, right. So this research project will help us to quantify the burden of mental illness among the aged population during the COVID-19 pandemic and will help us in determining kind of services required for the elderly and will make us better equipped for future. So currently we have administered the questionnaire among 200 non-institutionalized elderlies of age 60 plus using digital questionnaire and telephonic interview, and 2/3 of the respondents were males. Almost half of the respondents lived with their spouse. 1/4 of them were part of joint family. 1/3 of our respondents almost always check news and update related to COVID-19 pandemic on TV, and they get frightened after the news, and they're always worried. And that they say that the social distancing is now called as physical distancing is not enough to keep them safe from the virus, and many times we also don't know the source of infection. Almost 70% believe that the basic hygiene habits like hand washing, using masks, sanitizers will keep them safe. 1/3 of them keep checking signs for the infection continuously. There is anxiety. So around 60% of the respondents feel better as they are involved in some kind of creative work, and they are enjoying their lives with their grandchildren, maintaining this intergenerational bonding. Now, health-wise deterioration was also observed in many senior citizens. Over 40% they don't feel comfortable even staying with the family during lockdown. Anxiety, fear, depression, abuse, domestic violence, this could be the reasons for this, but they don't communicate this generally as they are afraid of their relatives. Further, we are administering the questionnaire amongst the elderly at our long-term care facility center and other centers in Pune, so that we can get a comparison between the institutionalized and non-institutionalized elderly. But I know our senior citizens are all happy in various institutions in Pune. In fact, we have daily communications with them. In fact, we are going to do this survey with 3,000 senior citizens living in Pune city. And we could do this because of hard work by the staff and the support from the trustees, especially Jaidev Naik, then patrons, executive committee members, philanthropists and donors. And therefore, I thank everybody for their timely help given to us. Now I will show you slides of our activities. So next slide, please. Next slide. So here you will see COVID-19 and Janaseva Foundation's initiatives. We are distributing this grocery item given to the poor families and elderly from the roadside. Then we are giving it in rural area of Pune. And then there is these are all photographs of our old age home where people are doing their own, even shaving is done by one of our inmates. And they are doing some entertainment activities. They are looking at the TV and they are calling their friends and relatives, and they are staying in the our homes very happily. So next slide, please. Now in this you will see the doctor is taking 24 hours care for these senior citizens. If necessary, they to take ECGs also. Unfortunately, we lost 2-3 patients during this period, but they were died not because of COVID-19, but it's because of heart attack and some septic infection because of some injury. You will see one doctor, 85-year-old doctor, Dr. Pimple Khare. At this age, he is staying in our old age home, but he is also taking care of our elders. Even that 75-year elder lady is there, and he is examining her. Now, mobile medical unit providing healthcare services in the villages. You can see how people are standing away from each other. The distance is maintained properly, and then all the doctors and staff, they wear their gowns and mask and gloves, everything, and we give these services in the villages. And in between there is a photograph of we always teach them yoga, because we have some yoga teachers. One of our trustee Kailas Patel is expert yoga teacher, and she goes and teaches it there. So with this, I think, if you allow me, I will go towards the telling you the two inspiring stories of two great doctors. So can I share the story first before going to question answer? So story is Dr. Jalil Parker from Mumbai. He is MD pulmonologist at Department of Chest Medicine, Lilavati Hospital and Research Center, Mumbai. He gave interview on TV, and people have become his fans after watching it. So he is more than 70 years, having diabetes, hypertension, and still treated more than 200 COVID patients in ICU. While treating such patients, once he had fever with body ache in the evening, and slowly he started having difficulty in breathing during night time, and he felt as if he is dying. So he called his junior, and immediately ambulance came and he was transferred to Lilavati Hospital. Next day he found that his wife was also admitted next to him, and she was also in very bad stage. So they were given full treatment, including antiviral drugs, and fortunately both of them came out of complications of COVID-19. But during that period also, just see his observations. When he was in the hospital, he observed that staff working for more than 40 patients was overburdened. Even PPE kits for consultants and the staff were not enough, and they had to wear them continuously for 8 hours without even going to bathrooms and eating food or drinking water, because of wearing these PPEs. So just see, this is the problem in private hospitals. So what has happened in our government hospitals? Everywhere there is a deficiency of these all PPEs. And whenever it was, when he was discharged, he found that the doctor who treated him in the ICU was just admitted, and he got the same bed in the ICU. So he was shocked. He was shocked. But at the time of discharge, he gave a message to the people not to panic because of this. I have braved the death. I have braved the death, and I came out more determined to what I have left behind. So I am there to cure people and help them live. So this is the most inspiring story of Dr. Jalil. And next is, of course, Dr. Subhash Salunke. Even Jane knows her. He is Chief Advisor, Public Health Foundation of India, Assistant Director, WHO CRO, and former Director General of Health Services, Maharashtra State. After retirement from WHO, he is now in Pune, helping the Public Health Foundation, but presently he is working as an advisor to the government of Maharashtra and Pune district administration to control and manage COVID outbreaks in the areas based on previous his experiences based on previous handling of outbreaks in the past. He is handling the health machinery for various aspects of containment areas. My addressing doctors, nurses, and other staffs of Sassoon hospitals, by addressing them, he has helped them to build strong teamwork to improve the quality of care. By interacting with deputy chief ministers and other ministers, health minister, he indicated how to prove community ownership and participation of people to fight against COVID-19. So being our trustee and chairman of research committee and my classmate, we always, we all requested him not to take part in the mission being more than 72 years, because he is more than 72 years and having diabetes, hypertension, ischemic heart, undergoing angioplasty. So, but he said all other doctors should be motivated and I should follow, they should follow the example. So though I am aged 73, I also work for 12 hours in a day. Continuously, I am looking after my patient, but from a distance, though I am having diabetes and I am on insulin. So in India, careless attitude of our people is causing many deaths. No PPE kits for doctors who are living unprotected lives without respect. So, and the most important thing is the health workers' risk is 33 times higher than general population of contracting this COVID-19 disease. So, thank you.
Thank you very much, Dr. Shah. And you know, comments in the chat box are saying, you know, commendable work. Thank you for your efforts. So if you can convey that back to, you know, all of your volunteers and staff. Mrs. Shah, thank you. We're now moving on to some questions and discussions, and I'd like Anne Lindsay, Susan Summers, and Greta Garnis. So Anne Lindsay, would you like to ask your question to Dr. and Mrs. Shah?
Okay, thank you very much indeed. Very interesting to hear about your work. I'm Anne Lindsay, I represent the World Federation for Mental Health at the UN in Geneva. And you mentioned some mental health issues. I just wondered if you could elaborate a bit more on that. You know, what kind of mental health care provision, service provision do you have for these older persons?
Okay, thank you, Anne. Dr. Shah, we'll go to Susan and Greta and then we'll come back. Susan?
Thank you, Jane, and thank you very much, Dr. Shah, Mrs. Shah. The compassion you show and the work that you've done is just, it's tearing at my heart to listen to what's going on. But thank God that you're there and doing what you're doing. We're interested from INPEA, from the International Network of the Prevention of Elder Abuse. We're interested particularly in the adverse effects of social isolation. And although you have these institutions or care homes and hospitals where you're taking excellent care of people, can you comment a bit about the general community of older persons living alone or older persons separated from their families due to quarantine, in light of the cultural, understanding and importance in India of family being together? Thank you.
Thank you. And Greta Garnis?
Good morning. Yes, I agree. It's a very interesting presentation. I'm learning a lot. On one of the slides, you mentioned that 2/3 of the elderly rely on social media and TV for COVID news. Is the Indian media presenting all scientific and medical information, or are they getting a certain slant like we're seeing in the States? And I'm also wondering, I noticed that far fewer females participated in your survey. I didn't know if that was an anomaly, or I was just sort of curious why there was such a gender imbalance.
Okay, thanks, Greta. So we've got lots of questions, Dr. Shah. So the first one was really about the mental health services that are available. So if you can respond to that, and then I'll give you the next.
Yeah, we have National Mental Institute run by the Government of India, and we have many mental institute NGOs. They are working in the care of Alzheimer, dementia, and actually at present in India, almost 180 million people, not necessarily senior citizens, but people, they are suffering from mental disorders. Maybe schizophrenia, maybe depression, maybe having dementia, and basically suicidal tendencies. So, and there are lots of suicide done by even the seniors also in India. So that is our major problem. And the thing is, government is looking at this and trying to as somebody asked me the question about that WHO mental health gap intervention. So that mental health gap intervention, we are also trying to do in our institutes. But the budget from the government is too low. It's really meager. It's for 50 crores for so many patients. So slowly, I think we'll work on it. We are at present doing various types of caregiver courses to them, wherein these mental diseases are covered, and that courses are given to caregivers, then to the paramedical like nurses and A&M sisters, and to the staff, the administrators, so that they should have the idea of all the mental illnesses. And we have our psychiatrists visiting to our old age homes frequently, and they give us consultation, and accordingly we manage this patient in our institute. But it's really a great need of the day, because number of mental patients are just increasing because of so many problems. Maybe because there is a joint family system is now no more there, and
So
income is another thing.
Yeah, Dr. Shah, if we can actually then segue into the next question. I mean, I think what you said was, you know, there's a limited budget. You know, the number of people with mental health conditions is 180 million plus, and you're doing work on the ground. If we go to Susan Summers' question, it was about social isolation, living alone, and the culture. How is that addressed in the environment of COVID?
Yeah, this is very important, because most of the people are at present they are staying in families, but few are actually only couples, and they are staying alone in the institution, alone in their own housing complexes. I have one example wherein my daughter's in-laws, they are staying in one institute, in one housing complex, and in the surrounding flats, there was one patient 90 years old, and he was having COVID-19 positive, and his son also got the same. And then unfortunately, both her in-laws are now suffering. My daughter and son-in-law are 100 kilometers away from them, and we are worried how to take care of them. Even there is no place in the hospitals at present, so they say that best thing is to quarantine them in the house or in the home only. So, and then, so that is one problem. Now loneliness for the senior citizen is another problem, because even family members, they do not have good conversation with them, and and then because of that, unless they have some grandchildren, they can enjoy their life. Otherwise they have to sit as it is, and if they know how to play mobile and how to talk on that, they just can do some conversation with their friends, but they cannot see anybody. So in lockdown period, there are a lot of psychological problems because of this loneliness. And because they are continuously there in the families, the youngsters and their parents are also worried. They are having diabetes and other diseases, and to get the medicines for them, it is also very difficult. And those who are couples, they have a problem how to cook food, because they cannot have maid servants with them. So these are there are a lot of problems for the elders.
Okay, Dr. Shah, the next question from Greta talked about why were there so few women in your survey, and does 2/3 of people find their information from social media? Is it factual all the time?
I didn't get the question properly.
That's all right.
Yeah. So I understand now. Yeah. So everywhere as such, above 60, the percentage of female is more in India, and that too even above 80, the percentage of female is more than males, and they have their own problems because they are most of the times neglected by the families. And
Dr. Shah, in the survey that Janaseva did, in the survey, there were fewer women. Was there any reason for that?
there were
less women.
no, no, in the survey,
Yes.
we have less female and more males, because we did that questionnaire, we asked to them randomly. So we were not knowing to whom we are sending the question.
Okay, all right. And the other question was about, is there fake news in social media or is it evidence-based?
Which news? Social media मध्ये COVID-19 ची न्यूज ही खरी आहे का फेक न्यूज आहे?
No, no, actually what we see is there are true news given in standard news lines, but in some news lines and basically on WhatsApp, we get fake news, and then fake news again frightens the people. But then every time police department takes care of it, and they immediately send a message on WhatsApp that this is a fake news, don't forward it to anybody. So that fake news are always there.
Okay, look, that's excellent. I'd ask Kathleen Brasher and also Vinod Kumar. So Kathleen from Australia.
Thank you, Jane. Thank you, Dr. Shah and Mrs. Shah. It was a very interesting presentation. I'm interested, given that a large number of people live with their families, what's the attitude to older people during COVID? In other parts of the world, we've seen a very negative attitude towards caring for older people during COVID. So I'm just interested to know the experience in India about the attitude towards older people at this time. Thank you.
Thanks, Kathleen. Would you like to answer that, Dr. Shah?
Yeah. That is actually I told in my previous talk only, because attitude of the youngsters towards seniors is at some extent it is not good. Because of that, there is a problem of elder abuse, or in some cases there is even violence also. And 40% in our study, 40% of the seniors are not that happy with the family even at present, though they are staying with their family because of COVID-19 disease, because of lockdown.
Dr. Shah, do you in Janaseva, do you experience a lot of ageism and age discrimination?
Yeah, right. Age discrimination is especially male and female, that we always see, because male, they are stronger, they have their own income most of the times, and females, they don't have their income at this age, and therefore there is always a discrimination, and they are neglected by the families.
Okay. Vinod Kumar?
Well, in my view, in a country like India, there is a kind of a social stigma attached to this illness, and this is largely contributed by poverty and absence of proper education. So I was thinking to ask my friend Dr. Shah how common it is for the people to avoid getting tested even if they have few mild symptoms. And once they are tested and some of those who are found positive, how willing they are to disclose the result of their test, because all this has bearing on spreading the infection further on. I would like to have your learned opinion on this point. Thank you, Dr. Shah.
Thank you, Mr. Kumar.
Yeah. In this, what we observed, that government has to interfere for doing this test, because tests are very costly in India. Most of them they cannot afford, and therefore government has come out with a scheme of doing even immunological test also. They are that way, they are less costly, and now more than many lakhs of tests are done all over India, But still, because of this population problem and poverty, we cannot test everybody, even if they are having mild symptoms. So when the symptoms like fever comes, and when they say that there is a breathlessness, they immediately we do this test. And if they are positive, then we send them for this X-ray, and otherwise, if necessary, CT, and then they are admitted in the hospitals for further treatment. Otherwise, for minor symptoms, we tell them that you better isolate yourself in the house or in the home.
Okay, thank you.
My point is, can I just continue, please? Very brief. My point is not that we can test or we cannot test. My point is how frequently the patients are unwilling to undergo the test because of the social stigma, and once they are found positive, how much willing they are to disclose to their relatives and friends that they are positive. What is their perspective?
Thank you, Dr.
Yeah, you are right. This is also a big problem, because many times patient says that I don't have this COVID and I don't want to undergo my test, even if he is having fever, and when they come to the clinic. So they straightway refuse, and they are, because they are afraid of COVID. Once there are 2-3 incidences in Pune where people, they did suicide once they came to know that they are having COVID positive. So that much they are frightened with this, and therefore they try to avoid. Even the patients, those who know they are having COVID and they are admitted, they also run away from the hospital, because they do not want that stigma. Once that stigma is there, now in our housing complexes, the problem is people, they are persistently telling the patient that please vacate your premises, because all others are staying and they are old. So as far as possible, it's a stigma. For example, a doctor who is working with the COVID patients, he is not allowed to enter into his house also in his society, because he is working and treating the COVID patients. So that stigma is also is very bad, because we have to restrict unnecessarily this, because one thing is sure, that you have to take care of yourself.
Okay, Dr. Shah, we've got questions from Ireland, and that's Eileen from the University of the Third Age, and also from Dr. Ravindra. So Eileen, are you able to ask your question to Dr. Shah?
Thank you very much, Jane. Dr. Shah, thank you for an excellent presentation. Just one question that came out from your survey: people relying on social media and TV for communication. That is the same here in Ireland. Is there a possibility or a danger that people now will be relying on this for their whole social contact, and no longer over the next 12 months have a need for face-to-face contact?
Yeah, ideally, we don't know for how long this COVID-19 crisis will go on, and therefore everybody has to take care. But even for next 6 months or even a year, we will have to wear masks, even in our clinics and even outside in the shops and everywhere, because that is your own safety. It is for your own safety.
So
it is very essential.
Yeah, Dr. Shah, do you think, because older people are using the television as that point of interaction during COVID, do you think as we come out of COVID, there'll be a dependency on that versus meeting with one another face to face?
Yes. They can.
Yeah, they can. There is no problem.
Okay, all right. So
yeah.
Dr. Ravindra. Dr. Ravindra, can you? All right. So Dr. Shah, Dr. Ravindra's question was, many doctors and staff treating non-COVID patients don't wear PPE kits. Even senior surgeons like Dr. Ravindra don't use it. Is that okay?
This is absolutely wrong, because we don't know who is the asymptomatic patient of COVID coming to our clinic. We don't know. So this is wrong. Everybody has to take their care. And in Pune and in Mumbai, while examining patients of ENT, ophthalmology, dental patients, they came very close to the patient. Doctors came close to the patient, and few doctors even expired. In Mumbai, there are 2 doctors, one ENT specialist and one ophthalmologist expired because he came in contact and he properly didn't take care, because he was confident that he is having only eye problem, and basically it was not eye problem. He had conjunctivitis, but absolutely he was suffering from asymptomatic COVID-19. So it's dangerous.
All right. Look, thank you for being so direct to that question. We have a comment from Dr. Asha Vijay, I beg your pardon, Rao.
Dr. Shah and Madam Shah, namaskar.
नमस्कार.
सर, मैं आपकी अप्रेंटिस रही हूँ टाटा इंस्टीट्यूट ऑफ सोशल साइंसेज से, और मैंने वहाँ अपना ट्रेनिंग किया है. मैं कुछ दिनों से IFA के I am attending IFA seminars and webinars, and there was a huge need of digital training for senior citizens. You are already in the field of training for nurses, geriatric care workers, and you have got a huge following of elders. Are you having any plans of training seniors, elders, so that they cannot be isolated during this type of period? As you said, it is going to be longer than we all are assuming. So your inputs in that, training for digitalization of senior elders, because then they will not be as lonely and isolated as they feel now.
Okay, thank you very much, Dr. Asha. Dr. Shah will respond. Thank you.
Yeah, this is very important, very important. What we did is, last year, we gave digital training for all those who are above 75, 1,000 senior citizens. And we insisted them that just now use this mobile for other purposes also, to call your friend, go on Skype or go on Facebook if it is possible. So various things we taught them, how to go, how to do bank transactions, and how to pay your fees from the or your charges of material you have purchased in the, so that you cannot, because you cannot walk or you cannot go up to the shop, you can do this. And that's why it was actually sponsored by Regional Resource Training Center of Ministry of Social Justice, and we trained them. And to our surprise, the one of the senior who crossed 85, first time he learned that, and he gave a big interview in one of the very famous newspaper in Pune. I am so happy to learn this, and now I am using all these apps and all. So this is very important, and I am sure we should go on teaching these digital things, or digital training is very essential. I agree.
Dr. Shah,
Thank you, sir.
Just as we wrap up the session today, can you just share with the attendees, how many volunteers do you have in Janaseva?
Actually, there are 50 workers and more than 20 volunteers are there. And surprisingly, 2 of our volunteers, and they are also working in the field of while distributing the food, they developed COVID positive, and both of the girls were admitted in one of the hospital in Pune, and today only they are discharged. So even if they are at risk, still they are working. So we are very happy and proud of our volunteers and our staff in our foundation.
Yes, look, thank you. Would you like to share some of the, what are your takeaway messages for the audience today?
Yeah, of course. What I will tell you is, to everybody is, take care of yourself. Take care of yourself and also others. This year we have learned 4 new words: coronavirus, pandemic, social distancing, and quarantine. So try to understand meaning of these words seriously for applying them in our day-to-day life. Share it with your friends. Global challenges facing vulnerable population like seniors during this pandemic, and therefore the lessons to be learned that good practice protecting and respecting the rights of older people in this bad time is needed, and we don't know for how long we have to take precautions till vaccine comes. So try to remain happy, healthy by doing yoga, meditation, exercise, maintaining good habits, and keep yourself happy. Don't live in fear. Spread hope instead of fear and be positive. Days are bad, we know, but don't become despaired and don't panic. We all are together in this pandemic and all will work together. So we hope very soon we will come out with this COVID-19 crisis vaccine. Until then, learn to live in this situation without fear. Try to maintain world economy. Though it is a downfall of economy, we must first value human rights. And economy can bounce back in great manner after some time. This is what said by Bharat Ratna, Honorable Ratan Tataji. And therefore, at present, give our elderly their rights and dignity. Thank you for your kind, patient hearing. Thank you.
Dr. Shah, it's been a real pleasure to be in your household today and listening to what Janaseva do, but also being part of your family. I know that Mrs. Shah's been with you throughout this town hall, and Sandeep, your son-in-law, is just off to the left. The rights and responsibilities, of older people are very much at the centre of the Janaseva Foundation. And through your work, you've not only inspired older people, but you've inspired government and civil society, and also the leadership which has informed WHO on many occasions. So we thank you for your commitment, but also sharing some of your life and the work of Janaseva today. In closing, I just want to acknowledge someone who is at the town hall, I think for the first time, but I may be wrong, and that's Dr. Olive Bryanton. Now, Olive, you and IFA have had a little bit of a history in that we were very proud to promote, the work that you undertook in your PhD. So I want to give the floor to you to actually share a closing remark, because Olive, you have an inspiring story. But thank you, Dr. Shah, Mrs. Shah, and also Sandeep. And I'm going to leave the final comment to Olive after I thank my staff, Andra and the team, and look forward to you next week, where we're going to have the great pleasure of listening to the United Nations, as well as the Office of the High Commission for Human Rights. So if we can just take it back, Andra, to the gallery. Olive, I give the floor to you. We can't hear you, Olive. All right, so let me just share with everyone, Olive, how we connect, and it's important. So Dr. Olive Bryanton, received her PhD at the age of 82, Olive, I believe. And so we celebrate, yes, I've got it right. And we celebrated because, can you have another go? Can you say something?
Can you hear me?
Yes.
Okay. Jane, thank you so much. I am really interested in this presentation was excellent. And I know that so many seniors need so much help. I really like the idea that seniors are being trained in using technology. I think that's going to be a huge help to everyone, not just the seniors themselves, but to the families and people who are providing for them. This was a great presentation. And Jane, it was so great. And thank you for all the support you provided me.
Well, look, thank you, Oliver. It's a pleasure to have you with us. So once again, Dr. Shah, Mrs. Shah, thank you for allowing us to be in your home today. And we'll see everybody next week. Stay safe and stay well.